Now we're going to look into shoulder problems. We have some preset diagnosis in the Skanlab DTK pulse for shoulder problems as well, like frozen shoulder mobilization, impingement syndrome, rotator cuff symptoms, and bicep longus tendonitis. Those diagnoses can only, in certain times of the problem, have a really beneficial effect of using the Skanlab DTK pulse. For example, a frozen shoulder that's come on the reverse period of its problem, like it's coming up more and more movements again, then we can kind of pre-treat the capsule and the capsulitis we have in the frozen shoulder to make the patient able to do some more exercise with the arm without too much pain, and get some more movements out of it by working with sling exercise or the different kind of medical training therapy exercise, for example. Impingement syndrome is a narrow point for very often for the supraspinatus tendon passing underneath the acromion, and by treating this area, at least we can decrease the pain a little bit, and we can also optimize the circulation in the tendon. Sometimes it could be due to calcification in the tendon you get these impingement problems. I can't say we can get rid of the calcification, but we can smoothen the elasticity in the rest of the tendon as well. Next to that, we have these rotator cuff symptoms. It can be the teres minor, it can be infraspinatus, it can be supraspinatus, even the biceps longus head can be affected in the rotator cuff symptoms. I'm going to choose to demonstrate treating the rotator cuff syndrome right now, which is very often you see a really quick result of treating this problem. Of course, next to doing some exercise, some stretch movements, some medical training therapy, we can for sure decrease the treatment time really a lot instead of doing nothing. But before we start the treatment, we have to do some settings again. We have to pre-cream the solid electrode, the return electrode, which the patient can hold in his hand. We can sometimes choose to have the patient laying on the treatment table, but I prefer doing it in a sitting position because that gives me the possibility to treat on the ventral side, the dorsal side, the lateral side. All the areas is reachable for me when I have the patient in a sitting position. If it's a specific supraspinatus tendonitis, I will ask the patient to move a little bit forward his body, put his hand on his back, if he's able to do that. Because then the tendon will come more forward, which means that it's more reachable for my treatments as well. So if the patient is comfortable sitting like this, we work the patient like this. Before I give the patient the return electrode, we do need to put some cream on it. And then I ask him to hold it in his other hand. Next to that, we put some cream on the treatment area. And it's very important for treating tendons is not only treat on the affected spot, but also treat in the length of the tendon and into the muscle. We need to open a reflow system in the structure to be able to get the optimized result. I spread the cream where I'm supposed to be treating the patient. Spread it out, I haven't started yet, and then I start setting up the settings on the machine. Pinch the shoulder on the machine, get the preset diagnosis, and go for the rotator cuff syndrome, and then say OK. I get the treatment time 7 minutes, a maximum dosage of 10, and then I can start the treatment on the treatment head, like pinching, so I get the green light up. I could hold the patient firm and then start the treatment. I can choose not to have my hand on the patient, it doesn't matter, but don't have like touch contact, have firm, good contact. Don't have like touch contact, have firm contact with the patient. Then you don't feel anything in your hand, it's nothing to worry about. But if you just have a finger on it, you can be a part of the circuit. But holding the hand firm, you won't feel any problem at all. Moving around in nice movements, not too quick, not too slow. working the patient really quick like this is feeling really uncomfortable and untrustable for the patient. So I prefer that you have a rhythm, and nice rhythm while working the patients, that the patients feel confidence with you and you feel that the patient can relax as good as possible. And I always ask the patient regular, is it feeling too warm? You okay, sir?
Yeah, it's okay.
Okay. If the patient say it's too warm, I pinch -1 time and go 1 step down. And so I continue through the whole session, asking regularly if it's getting too warm or not. And maybe he says it's too warm again, I go 1 more step down, and after going maybe in the half of the treatment times, I might be going 3 or 4 steps down. And if he after that says, well, now I don't feel nice warm anymore, then I have to go 1 step up. It's allowed to play up and down with this machine, not be set just in one direction. After finish the treatment, we can finish it now. We take some dry paper, get rid of the cream on the shoulder first, and I ask the patient to give me the handheld return electrode, clean that as well, and I also clean those with spiritus for disinfection. After doing that, we have to clean the area a little bit more to be able to get the rest of the moist out of his skin. So we take just wet paper with water to get the rest of the cream out of the skin. After doing that, we take some extra paper just to dry the area proper. And then we are ready to go. Of course, I'm going to ask the patient to have some paper for his hand as well, so he can clean his hand.